The guardians of the earth. We have a digestive disorder invasion. Please report and investigate immediately.
What? The digestive disorders are invading Earth again?
Copy that. We'll go investigate it right now.
Hold on, I'm on my way. Look! She is feeling unwell. Is she suffering from digestive disorders?
Let's go and have a look.
Ouch, my heart hurts. Why do I have a weird feeling in my chest and regurgitating sour and bitter liquid in my throat?
It seems like you have gastroesophageal reflux disease.
What is that?
The gastroesophageal reflux disease is also known as GERD, GERD. The stomach consists of a lower esophageal sphincter, which is always tightly closed, except when it is letting food to enter the stomach. The stomach also contains gastric acid. This is how the lower esophageal sphincter usually works. Once the bolus from the esophagus reaches the lower esophageal sphincter, the sphincter opens for the bolus entry and closes immediately. However, when the lower esophageal sphincter relaxes for too long, gastric acid escapes your stomach and backs up into your esophagus, and this is called an acid reflux, which is the cause of the gastroesophageal reflux disease.
Patients often have heartburn and regurgitation. They may also experience other symptoms such as non-burning chest pain, coughing, and have difficulty swallowing. Besides, severe heartburn and regurgitation may damage the esophagus.
Wow, it sounds so serious. What should I do?
There are many different types of treatments for GERD. For example, patients may change their lifestyle by adjusting their eating habits and diets and elevating their head during sleep. Over-the-counter GERD medicines like antacids, H2 blockers, and proton pump inhibitors can also be used to relieve the symptoms.
Moreover, surgeries like fundoplication and weight loss surgery can treat GERD effectively. However, over-the-counter GERD medicines are effective enough for most of the time.
I see. Thanks for your explanation. I will buy the medicines now. Bye.
I never thought that digestive disorders could cause such symptoms.
I know, right?
Look, I think it's the digestive disorders again.
Hey there, why are you in such pain?
I wanted to know why. Recently, I had abdominal pain and cramps. I also had diarrhea.
Aha, I knew it. It must be the irritable bowel syndrome.
The irritable bowel syndrome?
Yes!
Irritable bowel syndrome is a common gastrointestinal disorder affecting the large intestine. Abnormal contractions in the wall of the colon during peristalsis causes food to move too quickly. Thus, the colon does not have enough time to absorb most of the water from the food, leading to watery stool and diarrhea. Oppositely, when the food moves too slowly, the colon absorbs too much water from the food, resulting in hardened stool and constipation. There are multiple potential triggers to IBS, such as diet, stress, bacterial infections, and genetics.
Symptoms of IBS include having gas, fullness, and bloating in the stomach. The initial symptoms of IBS are determined according to the changes in the patient's bowel movements. They are either diarrhea or constipation. Other symptoms of irritable bowel syndrome include abdominal pain and cramps, as well as rectal bleeding.
I see, but what can I do with that?
There are various treatments for irritable bowel syndrome. For instance, you can avoid eating foods that trigger your symptoms. Since it is a long-term chronic condition, it can only be lessened through medication such as fiber supplements and antidepressants to relieve constipation and diarrhea and lessen abdominal pain.
Also, eating high-fiber foods, drinking plenty of fluids, exercising regularly, and getting enough sleep can help in fighting the IBS.
I didn't know about that. Thanks a lot. I will try to change my living habit now.
The root of digestive disorders is just so complicated. Sometimes make people suffer.
Good job, the guardians of Earth. Please continue to investigate digestive disorder on Earth and protect people's health.
Navigating the world of digestive disorders? We sure will.